have 5 points. So 0 points, there is no movement, nothing happens, and 5 points is to be like normal, and anything in between. And I will test 15 points.
Okay.
So at the end, if it would be normal, you have 75 points, which would be normal. And you can compare test with one side to the other, so left and right hand, and you can compare again beginning of the therapy and end of the therapy. So you have a instruction in your sheet again. First of all, first task would be, can you turn around for 90 degrees?
Quay 90 độ.
Yeah, perfect. So put your arm on your lap, and the first task is just to put the forearm to the table. So would be this.
Đặt cái cẳng tay trên bàn.
Yeah, okay. He had a little bit problem to bring it up. It was not quite normal, so yes, I see. I would say maybe 3 or 4 points for this. If it would be normal, it was just as quick as we can. You can do it with a time measure too, but sometimes it is not necessary to take the time to just look what the patient is doing. So that's the first task. Put the forearm on the table. Okay, back again, please. Next task is to put the arm outside. Yeah, maybe 3 or 4 points too. Okay, thank you. Then please, can you put the arm on the table and extend your elbow to the side, Yeah, okay, and back again. And I would do this one with the weight too. It's just some sand, a weight and sand. Yeah, and you flex the weight. Yeah, okay. So this would be 5 points. It's normal. Okay. Now you turn around, please. Just
Quay là thế.
Okay. You do it with the other hand. So arm on the table. Yeah. Back. Arm on the box. Yeah, very good. And flexion. Extension of the elbow, yes, and extension is the weight. So we push it forward. Okay, you get 4 points from it. Okay. Okay, would you just turn around so you look to my face? That's the first point. Next point is hand on the table as you sit, so just in front of you. The other hand too. Perfect. And back again. Okay, back again. And the next ones are hands on the box, one after the other. Perfect. I would say 3.
Thế liền cả hai tay à?
Tùy cổ chị ạ.
Okay. Very lazy patient today. Next one is to reach and retrieve. So you take the weight, push it. You put your elbow on the table, and you flex your elbow with the weight. So if the patient can grab it, he will grab it. Otherwise, I will put it onto his forearm. And, yes, and flex it. Perfect. And with the other side. Good. Okay. Perfect. Just a sand. So the next task is a very practical task. It is a can, just a can. Can you take the can and put it to your mouth as if you would drink? Perfect. Okay, it's empty. I'm sorry. Okay. So I would say this is normal movement of the elbow. So the next task begins to be a little bit smaller.
Vật nhỏ hơn là
Pencil?
Yes. To grab a pencil. Perfect. Maybe just to grab it, to lift it. Yeah. This is very begins to be a fine motor skills. So it's just to lift it. You don't have to put it into writing position. Just to lift it up. Yeah. Perfect. Okay. And the smaller thing to grab is a paper clip. So now it is important that you do not do this,
Yes.
but to grab it.
Yes.
Perfect. Okay, and with the other hand. Okay, yes. Sometimes patients cannot grab it directly. They have to use the corner. So
with the same point.
Không được phép.
I would say it is
The same.
Yeah.
3 points
Yeah.
if they cannot do this. So the other task is you have 4 playing cards, 3 playing cards, sorry, and now you're allowed to turn over the cards to show the other side, but now you can use the table side. Yeah, that's
Thế là
okay.
3 điểm.
And turn it over, one after the other. Okay, and back with the other hand. You can use the table side.
Dùng cái máy bài
Kéo xuống thôi.
Yeah.
Yeah. Perfect.
Very good.
2 point.
Đi casino được rồi.
Maximum bành.
Yeah, this is maximum points.
Không, nếu mà phải kéo xuống đây thì chỉ được 3 điểm thôi.
Để nó vẫn lên.
Không, cầm tại chỗ vẫn thì được 5 điểm. Có khi mà kéo xuống thì em vừa hỏi xong đi xem cố rồi chỉ được 3 điểm thôi.
When I flip test,
Đấy là cái hạt, đấy là cái hạt này nó.
Cái con bài,
Yes.
cái hạt đúng
You are
không?
not allowed to pick up the paper clip with the table.
Yeah.
That's not allowed. But you are allowed to flip the cards with
This
the
is
table.
okay.
This is okay. Yes.
Đấy, cái
Because
này
it
để
is
để
this
cái
would
bàn này đúng.
this is 5 points. Yes.
Yes.
It would be normal if I would say to you, just you weren't a patient, but say to you, flip over the card. You would do this. It's just a normal movement.
Đúng rồi.
Sử dụng cái ghép bàn trong trường hợp này.
Đấy là một cái cử động rất là bình thường.
Đúng rồi. Nó phải dùng cái lợi thế của cái ghép.
Okay. And there is just another fine motor part. You have 3, how do you call this? Checkers. Okay. You have to put one over the other.
Chồng lên nhau.
Okay?
yes.
Perfect. Okay. And with the other hand too. Okay, perfect. So it's 5 points too. Perfect. Now, coming to the end, you have a towel. Now you use both hands, and you should fold the towel once, once, and once. Okay? Yeah, perfect. So now you have a, you can compare how both hands work together. So you have to use both, and you see how they are doing one for the other. So you did a good job. It's 5 points again. What we have, last task, is that you try to lift the basket. The basket has about 1 kilo, 1.5 kilo. So we have a water bottle inside to reach the weight. Can you lift the basket onto the table? No, to hold, yes. With the right hand first. Onto the
Này toàn
table.
đơn giản.
Em chụp.
Perfect.
Vâng, em có máy em có quay về chụp.
And is also possible to do while standing. When the patient is standing, I would use the box or a chair, so you can do this one too. The other side. And the last task is to turn a key in a lock. Most times I do this task when leaving the room with the patient. So I put my key into the door, and it's just to turn over, just to turn the key in the door. So I put it. I put it inside, and the patient has to turn over both sides with both hands. And if I have the patient in a wheelchair, I just take him, and he can do this while sitting too. So this would be 15 points, so in total 75. We have one extra task with this, what's the name for it? You know what I mean?
Yeah, very nice.
We did this in addition because both hands work together, and you cannot do this with one hand, and both hands have to do a good coordination together. Can you put it together and okay? It's a little bit harder, but it's makeable. Yes, perfect. Okay. So this would be extra 5 points, but I can't. It's 75 in total. So maybe you have a result of
How many activity?
15. This is the extra 16.
Yeah.
Yes, this is extra. Maybe there is a result on the right hand from 75 points, on the left hand on 40 points. Could be possible. And in 2 weeks I would do the retest and would see what's got better or not. Okay. This test is it's very simple. You don't need very much material. It's just material you have, and normally it's done within 20 minutes with a patient. It's very easy. Okay. Okay. Always time. I think the last one I would just show you is a